sensitization to enable others buy into the laudable project.
Lobbying, the advocacy for this is supposed to have started longer than now. I say that without missing words. You don't lobby 2 days to the voting on a very important issue like this. It takes a lot of orientation. It takes a lot of advocacy. It takes a lot of sensitization to enable people buy into this all-important agenda.
The women groups have, however, resolved to continue with the protest until their demands. Aisha at this son.
Women have been urged to vote for leaders that will protect and defend the rights of women in the country. The World Health Organization Ambassador for Global Health, Mrs. Toyin Saraki, who gave the advice during a virtual meeting to mark this year's International Women's Day, said policy making and legislation were some factors inhibiting the advancement of women in nation building. Correspondent Julian Osamoto has details of the report.
Speaking during the meeting, the World Health Organization Foundation's Ambassador for Global Health, Mrs. Toyin Saraki, noted that despite women's contributions to society and Africa, they were still marginalized as well as deprived participation in governance. While calling on women not to lose faith, Mrs. Saraki, however, urged women to vote only for leaders who would not relegate their aspirations.
So it's quite clear, especially with what's happening in Nigeria, that we're going to have to relook at the way we engage with the war for gender equality, and we're going to have to exercise our voting rights. We're going to have to ask our candidates before we vote for them, not after we vote for them. How do you feel about gender equality, and how do you feel about opportunity for all, not just for women, even for the disabled, for children, and for adolescents? I'm very confident and capable that the Nigerian woman may be disappointed, but she's undaunted and she will succeed.
Mrs. Saraki also noted discrimination against women with disabilities, especially on areas of accessibility in the healthcare system, education, policy making, asylum seeking, among others. She, however, stressed for more inclusive programs and policies for women and girls with disabilities.
We know that people with disabilities are 3 times more likely to be denied healthcare, 4 times more likely to be treated badly in the healthcare system, and 50% more likely to suffer catastrophic health expenditure. So disability and poverty reinforces and perpetuates each other. Now, all people with disabilities face discrimination, and they're often invisible in policies, but women and girls with disabilities are subjected to double discrimination because of their gender as well as the disability bias.
The WHO ambassador called for a comprehensive data to support evidence-based programs development for PWDs, as well as more empowerment programs for sustainable livelihood for the disabled. I am Julian Osamoto.
You're listening to Capital FM News at dawn on Capital FM 92.9. In the headlines, Senate rejects President's request to amend Electoral Act. Women have been urged to vote credible leaders to defend their rights in the country. Still to come, Federal Road Safety introduces new measures to reduce road accidents in the FCT. Plus weather report, please stay with us.